Good evening. Thank you for joining us for tonight's webinar with Dr. David Kirkpatrick.
So thank you guys for being on here tonight. And like Jason said, it is going to be all about implants. So we'll go ahead and get started. And as you can see with, kind of trees waving in the background, I am doing this from home tonight. Just we are still in, Florida's still got some numbers with COVID, so we're doing everything that we can to make it safe for you guys, safe for us to still do what we do and do it in a very safe manner. And we'll actually hit on that a little bit more in just a second. But I can assure you that it is definitely safe to come in for consults. We're doing social distancing. You're not allowed into the building without a mask on. Your temperature's being taken. And we're doing a lot of other things as far as what we wear in surgery to protect you as the patient and us as the provider and, surgeons and assistants. So we'll jump right in. All right, so a little bit about me. I was born and raised in Kentucky, and I did all my school at the University of Kentucky College of Dentistry, and I did my surgery and residency at the University of Florida in Jacksonville. I am a board certified oral maxillofacial surgeon, and that to me is one of the, from a professional standpoint, one of the most important things that I've accomplished. And it is very important for you guys to know as patients or potential patients that you want whoever is treating you to be a board certified oral maxillofacial surgeon. It's the only way we have that really kind of standardizes what we're doing and making sure that who's treating you is on top of their game and have taken the necessary steps, because it is a big ordeal to become board certified. We'll start with a very short commercial that lets you guys know what we're doing to make sure that you're safe. Caring for yourself and others hasn't been easy lately, but we want to remind you just how important it is to care for your smile.
At New Teeth Now, we're ready to help, and we're taking every precaution.
We're practicing social distancing and checking everyone's temperature.
All of our employees are wearing masks and during procedures are in extensive personal protection to keep you safe.
Now's the time to get the smile you've always wanted. Call to learn about our specials and visit newteethnow.com.
Okay, so that is something that we put together, and we've been advertising here in the Tampa Bay, Orlando, Florida area. And, I think it's important for patients to understand that we're doing everything and more than what the CDC recommends, because we are very blessed to be able to be back in practice after the quarantine and the shutdown, and we want it to stay that way. So we're trying to help everyone, stay safe in our practice. So dental implants, they are recommended by the American Dental Association, which is their national association, as the best way to replace missing teeth. And for those of you that do not know what an implant is, because I get this question a lot. So if you look at this is the implant, the gray screw looking fixture. This actually goes into the bone where your tooth root would go, and that replaces the tooth root and gives either us or your general dentist the foundation to make and fabricate and deliver your crown, which is the tooth part. A lot of people think the implant is the tooth, like you just come in, you get the implant put in, and that's your tooth. But it's actually a couple different stages when you're talking about replacing single teeth, where you put the implant in and you come back at a later time and get your crown. Now, what we're going to be talking about tonight mainly are what we call hybrids, but it's basically one big bridge that it's like a horseshoe shaped bridge that replaces everything in one jaw. So we can replace everything in all the teeth in the upper jaw, all the teeth in the lower jaw. We can do that in one day with our technique for the New Teeth Now procedure, where we place these implants and we can put your teeth on the same day. So you come in as you are, and whether you have a mouthful of bad teeth or no teeth and a denture, we either take your teeth out and put the implants in, or just put the implants in and you get your new teeth on that same day. They are a temporary set, and we kind of get into that a little bit later on this talk, but they're a temporary set that you wear for about 6 months, and then you get your final set. But these temporary teeth, we want them to look and feel as good and look the way that you want your final teeth to look like. So when it comes time to make those final teeth, you're like, hey, I love them. Just duplicate them in that zirconia material. So this is kind of showing you how the implants are positioned. So there's usually, you know, three on one, couple on one side, couple in the front, couple on the other side. And they enable us to secure the full bridge. So when you're chewing wherever on, you know, on the teeth, the force is evenly distributed across the entire arch. So all the implants are absorbing the force. This is how I would typically do the lower jaw. So in the upper, I tend to do 6 implants on the upper, and I do 4 to 6 implants on the lower. They're evenly spaced out, so every kind of all the force is spread out where the chewing surfaces are supported evenly in a standardized fashion that our lab looks at, so you can have the support that you need to eat what you want. So I'm going to show you a few before and after pictures tonight, because I think that they do a really good job at showing you guys, you know, exactly what we can accomplish better than I can just sit and tell you that, hey, I can take your teeth out, put these implants in, and make you look really good. But it's easier if you can see patients that I've actually treated. All these patients are my personal patients. They're not pictures off the internet or out of a book. They're patients that I've treated, and it's their, you know, the result that they got. And, you know, a few of you, I've had some comments on like, well, why I don't want my teeth to look that perfect, or I don't want my teeth to look that white, or I want my teeth to be more Hollywood smile. Well, that's what you can get. Like, if that's what you want, these teeth are what these patients have specifically asked for. So the patients play a big role in picking out what you want your smile to look like. A lot of times patients will bring in pictures from when they were younger or before they had problems with teeth, or they'll bring in a picture of a celebrity and they'll say, hey, you know, I really like the way this person, when they smile, the way their teeth look. Can you make mine look similar to this? So, and that's great. And that makes it easy when you do bring something in like that, because our restorative team and our lab, which is all in-house, and you'll learn through this talk that that's super important as well. But that makes a difference on how they can approach you, and they know what you're looking for. So Gloria, she's a patient of mine that I've treated several years ago, but you know, if you look at her, she's got a lot going on, a lot of problems in the mouth. She was involved in a car accident where she broke a lot of teeth on the, you know, the front part of her upper jaw. And then she kind of just let things go because she had this makeshift partial that a dentist made her that kind of snapped over everything. They didn't take out the roots, which was, you know, a bad thing to do in one sense because they left the roots in, but it was a great thing that they did for her from my standpoint because it maintained the bone. As long as there's roots in the bone, then your bone has a reason to hang around. So you usually end up having enough bone for implants without us having to do some different techniques. So she was in that category, and she was very self-conscious about the way her teeth looked. She couldn't really eat what she wanted. She had pain when she was eating, and she did not want dentures. So she came in, and we sat down and talked with her through the consult and discovered that she did have enough bone, and we talked about the ways that we could get her to a healthy, pretty smile from what she wanted. But I want you guys to hear what she had to say about this.
The car accident I had was tragic and lost everything, just all down to nothing, like gums. And after that, I went to a dentist and I got a plate just to fit up there. And then I would use adhesive to hold the upper plate to keep it in place. And I would have to do that like every 2 to 3 hours. Go in the bathroom, put my adhesive on, and sort of stay up there to keep it from. It fell out a couple of times, but I was like surprisingly hit it, you know, and just kept my mouth closed. I spent a year looking for a dentist that would do what I really needed done and right now. And I found Dr. Kirkpatrick. So then I came over at 7 o'clock in the morning, and about 4 o'clock I was going home and I had teeth. And I'm like, oh my God. Now I'm able to chew my food, I'm able to taste my food, I'm able to swallow my food and smile. I can smile as big and pretty as I want to. And I thank Dr. Kirkpatrick for making that happen.
Okay, so here's her before and after. And this picture was immediately after, and the video that you saw was Gloria in her final restoration. And, you know, very similar. It's just a different material, and we'll kind of hit on that in a few minutes. But that's what we're looking for, and that's what makes me be able to get up and, you know, go do what I do and stay on top of, you know, all the current treatments and guidelines and safety procedures and all the new technology with implants and what we can do with them. And that's one of the reasons that me and my partner decided to dedicate our practice and basically our professional lives to helping patients like Gloria. Because, you know, you hear her story and then you see how it changed her to where she can eat foods the way she wants without it hurting. She can go out, she can smile the way she wants. And that's kind of why we're in this game. So why do patients come in and why do they want to do this new teeth now procedure? Well, number one should be to restore your total body health. We now know, or we've known for a while, but now it's kind of evolving in the medical community, not just the dental community, that actually, you know, the mouth is, you believe it or not, it is part of the body. And it needs to be looked at part of the body, because when the mouth has periodontal disease, missing teeth, where you can't chew your food appropriately, and it gives you, you know, gastric problems because you're swallowing whole food that you should be chewing up into small pieces. Or if you have periodontal disease with just infection in your mouth, that takes its toll, not just in the mouth, but on the entire body. It also, you know, definitely brings out a smile, which will improve your self-confidence, gives you the ability to eat what you want without pain again. For those of you that are dental fearing patients and have a phobia of going to the dentist, you are asleep during the entire procedure. True general anesthesia. So you come in, you go to sleep, we do what we need to do, you wake up and it's finished. So we try to make it as easy as we can. And the postoperative pain level always surprises us, so it definitely should surprise you. We do give you and try to cover anything that you would have, you know, from a pain standpoint. But to be honest with you, most patients, you know, we give, my typical regimen is I do prescription strength ibuprofen, and which is 800 milligrams ibuprofen to take every 8 hours. And then usually Lortab or Percocet, depending on the patient and, you know, if they've had anything in the past that worked or did not work for them. But most people, the Advil is all they need. They take the Advil and they take a Percocet just as needed for breakthrough pain. But it's very common for patients to tell me that, hey, you gave me all these Percocets and I ended up taking one the night of the surgery. And I was just scared I was going to be in pain, but I never really was. So I think that's, you know, that's how the postoperative pain level surprises us. So with the oral body connection, one of, you know, just a quote that I like is, I kind of came up with this, it's the mouth is the gateway to a pretty awesome creation. And if you think about that, it's the first thing that encounters the air you breathe, which keeps you alive. It's the first thing that encounters the food you eat, which keeps you alive. You know, so without the mouth, you really would be struggling with the rest of the body parts and organs. So it is something that we need to pay attention to and address when there are problems going on in the mouth. It's well documented in the literature over and over again, and it's continued to be studied, how periodontal disease affects the other parts of the body and the other organ systems. But we definitely know that it increases your chance of respiratory diseases. Say you're an asthma patient or a COPD patient, if you have a mouthful of bacteria and you chew your food or you're breathing breathing air into your lungs, you know, that can stimulate an asthma attack. That can stimulate, COPD response. Same thing with digestive diseases. Increase your risk for having a heart attack, osteoporosis, stroke, diabetes. I mean, you can read the list, but what it all boils down to is the longer your body's fighting an infection, a chronic infection, it could be in your big toe, it could be in your mouth, that it reduces the effectiveness of your immune system, which can shorten your overall life expectancy. And here's what it looks like. This is what we see every day. So the picture on with the natural teeth there, you can see the crowns, see like a yellow, brownish colored material and structure. Well, that's to the teeth. We're not supposed to see that. The bone and the gum are supposed to be covering that. So they've got significant bone loss. The gum has followed the bone and receded down. So you're starting to see that recession. You'll see the roots. They can be very sensitive to sweets, to cold, to hot. And then you can see the picture on the right, which is the after picture, and that's immediate. That's same day. So I took those teeth out, cleaned the periodontal disease, got rid of the periodontal disease, put the implants in, and then closed everything. The little strings or the threads you see, those are stitches. They're the sutures where I closed the incision that I made. And those titanium-looking posts are the impression pins. So those are things that we put in to take the impression with your temporary teeth. And then I take those out, send them to the lab. They make your teeth perfectly fit your implants because they have to be extremely precise, otherwise they don't fit at all. And then they give them back to us. We put them in your mouth, and you're done. These are the little connectors. These are the abutments. But if you look, the gums are pink, healthy. The periodontal disease is completely gone. And this is his before and after. And this after picture is taken at his 1 week post-operative appointment. So you can see the difference. He's even lost his man bun. But if you look, the smile that he's got, it's a totally different perception there. So if you want to be truly healthy, you must restore your oral health. So who's a candidate for this procedure? Well, obviously, if you have no teeth or you're unhappy with your dentures, you're a candidate. If you have a mouthful of bad teeth or severe periodontal disease, you're a candidate. This last one, if you have ever been told by another dentist, another oral surgeon, another periodontist, that you do not have enough bone for implants, because it drives me crazy. I see this or hear this from patients when I do consults on a daily basis that, man, I went for a consult a year ago and they told me I wasn't really a candidate for implants. I just needed to do dentures, and I got discouraged, so I just stopped going. I kept what I had and didn't get rid of my periodontal disease, or I kept my dentures, and you're telling me I'm a candidate for this. Well, with our new teeth now procedure, I have not had a patient yet, and I've been here since 2007, that was not a candidate and I could not do this procedure on. So if you've been told that and that's why you're not pursuing this, you need to come see me. Another patient of mine kind of had everything going on: decay, infection, periodontal disease. He had a really gummy smile too, and that becomes important when we're planning this procedure. But that is a draining fistula, which is infection associated with a tooth. It's kind of eating its way through the bone, out of the gum, and it's draining into his mouth. That's just a bad situation, so we needed to take care of that. But he wasn't really sure if he wanted to do his teeth or maybe remodel his house. His family helped him make the right choice, and he ended up doing his teeth, and here's his after picture. So you can see what we can do, especially with the technology that we have in the office, the surgery that we can accomplish, the restorative team that we have, our coordinators, our lab, our assistants. Basically, it's a big team approach to be able to take a patient from that before picture to that after picture on the right. Just totally changed the game for this guy. So people who have dentures, her picture on the left, which is the before picture, it doesn't look that bad because it's a denture. But she was tired of having something that she needed to take out at night and put on a nightstand or put in a jar and let it soak overnight. She wanted something that was stable, secure, wouldn't come in and out. She didn't need to have denture adhesive, and she wouldn't worry about it coming out like at a dinner with friends, and she didn't have to use adhesive. She wanted implants, and we were able to take the denture out, put the implants in, new teeth on same day, and that's her after. Another lady, denture, been told for years she was not a candidate for this procedure, that she didn't have enough bone for implants on the upper jaw. She needed to get used to her denture. She came to see me really on kind of a last ditch effort. And she was like, hey, I know what you're going to tell me already, but I thought I'd come in because I saw what you said, that, you know, you never had a patient that you couldn't do this on. I know you can't help me, but hey, I wanted to come over and take a chance. And she has very little bone, but she had plenty of bone. We threw her denture in the trash, implants in, and that's her after picture. Totally changed her life. You know, she didn't have to worry about her roof of the mouth being covered, denture adhesive, or the glue that holds the thing in ever again. She's got implants. She can smile. She can eat what she wants. And, you know, the cosmetics is kind of like a bonus that comes along with it, but huge difference. Another lady from the northeastern part of the United States, she knew she needed zygomatic implants or extensive bone grafting. She didn't want grafting. She wanted to do implants and zygomas. So she came down from the Northeast. We did a consult. We set her up, did her surgery. That's her before, and this is one big one-piece bridge on some decayed roots. This thing actually moves when you wiggle it with your fingers. We took that out, got rid of her disease. Now, here's how we do this on people who do not have a lot of bone. We do something called zygomatic implants. And these are for the upper jaw only, but you can see she's got really good bone in the front, really good bone in the middle part, which is here. But then these dark areas here, her sinuses open up and they drop down, and her bone goes from this tall to this tall. And that's where, if you see someone who can't do zygomatic implants or wasn't trained to do zygomatic implants, then your option is going to be where you don't do it and you keep a denture, or you do significant sinus lifts and bone grafts and then put conventional implants in, but the process takes about 1.5 years. And it's multiple surgeries to graft the sinuses. With the zygomatic implants, they can be done without bone grafting, without a second procedure, without waiting on the bone to heal, and it's done in 1 day. And in my opinion, when I can put implants into your native bone that you've grown and developed with, instead of bone that I've tried to put there and make you grow, to me, they're always stronger. I mean, and here's a before and after picture of a patient that has no bone hardly in the upper jaw. And this is called a quad zygomatic case. So quad is 4, so you do 4 zygomatic implants. And then they did have a little bit of bone that I found to put a conventional implant in the very front, which is kind of a bonus for this patient. I try to put as many as I can to give every patient as much support as I can. But, you take a patient who had been through multiple procedures, multiple other surgeons who all said that they weren't a candidate for implants, that you're going to have a denture the rest of your life. And we were able to help them and do this. So Beverly, she's a patient that, kind of like what you've seen before, just at her wit's end, didn't really have a lot of hope for implants. And she came to see us, and I want you to hear her story as well.
I have a top denture, and it does not stay in place, and it rubs my gums constantly. And even when I was in my 20s, I had bad teeth, so it was always, when you would smile, you would cover your mouth. It just becomes a habit, and I guess as I've gotten older, I've just learned how to smile without showing much teeth. On the morning of the surgery, I came in. I was nervous, and they talked to me, and they tried to put me at ease. We went back, and then she says, "Okay, I need you to count backwards," and that was it. That's all I remember. And when I woke up, I was actually just, it was amazing. You look up and they're like, "You're done," but it felt like I had just gone to sleep. They handed me the mirror, and I was just very happy. It was like having a full set of natural teeth that was given to me. New Teeth Now gave me the gift to be able to look in the mirror and actually see the Beverly that I haven't seen in a very long time. The one that I've missed dearly, and I'm glad is back. I feel like I am the Beverly I should be.
Okay, so you can see her before and after. And that's a pretty amazing story. And that's why there's certain patients that do these short little videos for us, the before and after, or tell their story. And some of them are just special, and you know that. And I think she's one of those. But, you know, that's typically what we see with our patients on a daily basis. So the New Teeth Now Total Facial Makeover, I'm going to just very briefly touch on this. But so another part of my practice is I do facial cosmetics. And, you know, that includes chin and cheek implants. And I'm not talking about dental implants. I'm talking about cosmetic ones to give you plumper cheeks or more of a defined chin, brow lifts, eyelid enhancement, face and neck lift, lip lifts, rhinoplasties, which are nose jobs. So in a lot of these procedures, the reason I mention this is a lot of these can be done at the same time that you do, you know, your teeth. So I've had several patients come in to do, they came to the office because they had a problem with their teeth, or they wanted the New Teeth Now procedure, and they end up doing that procedure plus a facial resurfacing with a CO2 laser, or that New Teeth Now procedure and a neck lift where we liposuction fat out of the neck, or eyelids, or, you know, if you have droopy excess skin on your upper eyelids, we can do that at the same time. There's a few procedures that I can't do at the same time, and that would be, I don't really like to do a facelift with this, and I don't like to do, or I can't do a rhinoplasty because of just the general anesthesia. But, you know, here's a lady who came in. She's one of those patients that came in looking for help with her teeth, and she wanted implants. And then she figured out that I also did facial cosmetics, and she wanted to know what I could do for her fine lines and wrinkles and brown spots on her skin. And we ended up doing the New Teeth Now procedure and a full face CO2 laser. Super cool procedure to do in conjunction with the implants. And I mean, look at the difference. I mean, wow, that the after picture is essentially that before picture's younger sister. And she was super happy. You know, a lot of the fine lines and wrinkles just completely are gone. I mean, it's not going to get rid of everything, but pretty much all of her sunspots, the age spots, they're gone or significantly improved, as well as the wrinkles. And not to mention her smile looks great. Facelift before and after, you know, if you check out the angle of the neck, the fat in the neck, the banding, that's gone, you know, compared with this. Another facelift and neck lift before and after with a brow lift. And, you know, I'm not trying to take patients back to when, you know, you're 6 years old and it looks like you've been in a wind tunnel. I want to still make you look very natural, but very refreshed. Chin implant, this is a 30, 40-minute procedure that we can do that. I mean, if you look on their before picture, these little dimples in her chin, that's from a muscle called the mentalis muscle. And she's straining that muscle just because she can't really get her lips, her chin's not in the correct position. So a chin implant, that mentalis strain completely gone. So with dental implants, you know, they'll never need a root canal. They're not going to decay. They're very easy to maintain. So it's something that, you know, you take care toothbrush, toothpaste, and you go get cleanings every 6 months, just like you would for your natural teeth. So patients ask us all the time, well, what do I do with these? And I'm like, well, you do the same thing that I do with my natural teeth. I brush them twice a day, I floss. Occasionally I'll floss, and I do go to the dentist and get my teeth cleaned every 6 months. That's what you need to do with these, because anything that you can't take out of your mouth and put under a sink and wash with your hands with soap and water, you have to go get professionally cleaned. So another before and after. This is one of the most important things you're going to hear with this webinar tonight. So everything is done all under one roof, and that's extremely important because, you know, we built this place for this procedure specifically. And so when you come to see us for the consult, you'll see me and one of my implant coordinators. Your impressions are done here by our restorative team. Your surgery is done here by me. Our lab, your teeth are actually made here in this building, and the final teeth are made here. So everything is under one roof. We don't see me for the consult, go somewhere else to see our restorative team, then have to drive over to the lab to let them look at you. Everything is here, and I can't stress how important that is to get things, A, done the right way, and B, done where, you know, when a lab technician can come out of the room with a restorative doctor and look at you and see your skin color, your facial shape, that's how we get the teeth to fit and look the way that the patients really want them to. And everything's all in one day. So it's all under one roof, all in one day. The procedure's done in one day. You get your temporary teeth, which are made of acrylic. Your final teeth, which are the permanent teeth, they're made out of zirconia. Both teeth look really good. It's just the acrylic are a lot easier to adjust and manipulate during your recovery. So it takes about 6 months for the implants to fuse to your bone. And after they're fused, then we make your zirconia teeth. The other reason that we do that is because we know you're going to have shrinkage of your gums. You're going to get a little space in between your temporary teeth and your gum tissue. We know that's going to happen. We know you're not going to like it, so that's why we wait until your gums have settled to make your zirconia teeth. The consult, that's your first visit with me. It's about a 1-hour appointment. We obtain an iCat, which is a CAT scan of your face, and then we use that to develop a treatment plan. And we actually sit down and go over the CAT scan with you. So I'm looking at it for the first time with you, and we're planning your surgery. So you're getting to see exactly what I'm planning to do to you, from down to the size of the implants and exactly where they're going. This is Shauna and Debbie. They're implant coordinators, both very good at what they do. They've been doing this for a really long time. And a lot of times I walk into the room to do the consult and then meet you for the consult. And it's basically everything I'm talking about, they've already gone over with you. And you're kind of like, oh, everything I say, you're like, oh yeah, well, Shauna told me that. Oh yeah, Debbie told me you'd do that. And it's, so you get a very detailed consult. When you're done talking to them, me, and seeing your CT scan, you know exactly what's going on with this process. Our restorative team, Dr. Nafal and Dr. Dibbs, they've been doing this for years. They're both extremely knowledgeable in this procedure. And, you know, I would put them up against anybody in the United States with how these things are made and how to make them. And, you know, it's incredible the number of patients that they've treated and completed with this procedure, because it's essentially what they do. And you're going to see a little short video about Dr. Dibbs and him talking about the relationship and how important that is to have, you know, the in-house lab.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable, having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient, that you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists, and they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
Okay, so I think that, that kind of explains a lot about our restorative team and the lab. And, all those the pictures and the videos that you're watching, those were some of our lab technicians that was inside the lab. And all that's here. It's all inside our practice here. And there's just it's a pretty unique place because there's not a lot of places in the world that's like this facility. And I think that's something that people don't think about or people don't even know to ask about when you're going into a consult. And it's common, we'll see patients that come in for the consult and, Shauna or Debbie will take them around an old tour of the office if they want that. It's difficult to do that with COVID going on now. But when they do that, or when you do come back and you see the lab, you're kind of like, wow, okay, I've never been to an office like this. So it's a pretty unique, special place. So this is me and part of my team. It's important to know that, like, when you come in to see me or you come in to see our office, you're going to see like the same people. You don't get shuffled around between, like, oh, you'll see me for the consult, another surgeon for the surgery, me for your post-ops, and somebody else to other post-operative appointments or evaluations or your releasing appointment. You're with the same people, and that's super important because we figure out, what's going on with you. We get to follow you through the process, and it's just when you have that attention to detail, it can't get much better than that when you're trying to get somebody from point A to point B in a surgical setting. And with our anesthesia, it's the same way. These two CRNAs, we now have a third one that's with us quite a bit. But like Jack Daniel and Kim Cherry, and then we have Steve Lanier, who they are really, really good at what they do. They've got tons of experience, and I trust them. Actually, one of them put one of my daughters to sleep for me. I had to do a quick procedure. So if I trust them with one of my daughters, I definitely trust them with my patients. And they just help us do the procedure in a safe way to get patients through this procedure comfortable and in a safe manner. And I mean, by the way, who better to put you to sleep than somebody named Jack Daniels, So this is the front of our building, and the entire team, and it really does take a facility like this and a team like this to make this whole system work. And it's just, it's kind of cool to see that, to know, like, when you're not coming to a tiny little office in a strip mall, You're actually coming to a true outpatient surgical clinic to where you can be treated and get things done in a safe manner, but also in a way that, you know, it gets you to your goal. Infection-free, and to teeth that you are proud of the way they look, and you can eat, you know, back to a diet that you can eat what you want without pain or worrying about teeth coming out. So thank you guys for joining us and being on here tonight. I know there's things that you could be doing on a Tuesday afternoon, but for those of you that are interested in this or potentially need this procedure, it's important to kind of, the more you know, then the better decision you can make to pick a procedure and a surgeon to treat you. But thank you guys for joining us. And once again, if you have any questions or you do want to schedule for a consult, make sure you call and schedule. We will be open tomorrow. Thank you very much for being on here.